Very good afternoon to one and all. On behalf of the PCOS Society India, I welcome everyone to a very special program, Connecting with Unconnected. Today, we've all gathered here to commemorate the International PCOS Awareness Month. PCOS, Polycystic Ovarian Syndrome, is one of the most common female endocrine disorders. Whether it is me, whether it is you, or any woman, we are very keen to know that if I have irregular periods, do I have PCOS? What are the other symptoms? What is the treatment? Can this be cured? Can I eat this? Can I not eat that? Can I exercise? Am I normal to conceive a child? Will I get cancer or diabetes in later years of my life? Will I ever lose weight? And the question list goes on and on. I'm sure we are all hunting for these answers. We do a lot of searching on the Google and internet. To address all these very pertinent questions, today amongst us, we have experts from different specialties. We have a gynecologist, an endocrinologist, a dermatologist, a psychiatrist, a nutritionist, an exercise specialist, and a wellness expert as well, who will be sharing the correct information about this condition. I'm very sure at the end of this informative session, we will be able to break certain myths. And this will be a very meaningful discussions by all the panelists so that all the misinformation that you find on Google and WhatsApp can be answered. They will also guide women not only about the diagnosis and symptoms and also on the treatment modalities such as lifestyle as well. And if you have any questions, for those who are attending this session, I request you to put the question in the chat box so that these doctors and experts can answer in a very simple language for you. Besides the medical experts, we also have with us celebrity chef and a celebrity trainer who will show you the right exercises and healthy recipes as well. And I'm very excited to share that we have very, very famous and eminent personalities who are our chief guests today. Interestingly, we also have a celebrity who will share her personal experience, the entire journey of overcoming PCOS. Well, that's not all. There are huge prizes also waiting. We have conducted a quiz, a slogan contest, and a digital video contest among all the college students all across India. So we are going to announce the prizes today as well. And I'm very excited to present this amazing program to all of you. And believe me, this is possible only because one and only. The one person who has dedication, passion, and that person is Dr. Dhuru ma'am, who is the founder president of the PCOS Society India. Well, it's my privilege and honor to introduce Dr. Dhuru to all the panelists. Dr. Dhuru ma'am is a practicing endocrinologist. Ma'am is the director, Gynac World, the Center for Women and Health. Ma'am is the founder trustee of the Women's Empowerment Foundation. Ma'am is the trustee and chair and past president of medicine. Ma'am is the past president of ESAR, FOXY, and MOGS. She's the past director, Digital Education, International PCOS Society. These were a few words about ma'am.
Good afternoon, ladies and gentlemen. I welcome you all to our program on PCOS awareness whilst we are celebrating the PCOS International Month. Today we have amongst us very prominent personalities, both including on the days and out there amongst our delegates. We all are aware that PCOS is a condition which actually we have been talking very recently about it a lot. But the problem started almost 300 years ago when an Italian scientist discovered that when he had opened up a woman, he found that she had large ovaries, which were like, very shiny, pearly ovaries, which were the size of pigeon's eggs. And he correlated with that patient where the patient didn't have periods at all, or she got periods every 3 to 5 or 6 months. So he was a little amazed looking at those ovaries, and he took a slice of it just to check what exactly it was. And then, lo and behold, the lady started menstruating a month later. And he somehow connected that when he took a piece out of that ovary, the woman started menstruating. So that word got around and many women came to him for the same treatment. And when he did that treatment, he managed to get success in quite a few patients. Following that, this was 300 years ago. Following that, in the 20th century, in 1935, that is almost 200 years later, when there were two scientists Stein and Leventhal, where they connected the look of the ovaries with the look of the patient. The patient had a long beard and she was getting bald, and she had these same shiny ovaries in her womb, in her abdomen. So did the same thing, and they found that she also started getting her periods, and she also regularly, once she started getting the periods, the hair growth started diminishing. At that point in time, we called it the Stein-Leventhal syndrome. It's been over the years, I think from the 70s onwards, that has been so many technological advances in terms of diagnosis, in terms of therapy. We have better hormone assays, we have laparoscopy, we have ultrasound. We have so many tests to do today that we are able to determine what's going on within a lady who is suspected of having polycystic ovarian syndrome. Now, the same syndrome used to be called polycystic ovarian disease long back, but today the terminology is syndrome because there is no fixed way we see a patient. Patients come with different sort of appearances. Women come, young girls come with probably cosmetic issues, menstrual issues. A little older women may come to us for fertility issues. As they get older, they get pregnant and they have other issues during pregnancy. And as they get even 40 plus, they have some different issues. They may be either obese, they may be lean. So we have all kinds of phenotypes we see. And hence it is called a polycystic ovarian syndrome, for which we still don't have a reason today as to why it occurs. And today too, when everyone knows with science that it's not the ovaries which are at fault, it is the hormonal imbalance in the body which is making the ovaries look like this. That is the reason why the problem occurs. And hence, there's a global attention to this. And many people feel we should rename polycystic ovarian syndrome into something else. They're still not sure what to call it, because when we say polycystic ovarian syndrome, it means we are blaming the ovaries. Actually, it's not the ovaries. It's the ovaries responding to those the function of the hormones which are not balanced. So this is a little bit of history for you to know what really we are talking about. Today, there is so much confusion about PCOS, both amongst women and amongst physicians themselves. No one really knows what really is PCOS. Of course, we know how it's manifesting. We know what really happens, what we find in the blood reports, what we find in laparoscopy. But we still don't know the cause of why polycystic ovaries occur. And this is where we are going to be discussing today with all the experts who manage PCOS. Because different symptoms, different signs, and therefore you need different experts to help you take care of these women. Someone in your circle around you must be having PCOS. I'm sure all of you out there must be knowing at least one person who has PCOS. And it is so very common. Everybody's discussing about it. It's all over the internet. It's all over WhatsApp. It's all over Instagram. So why are we discussing it today? Because we want you to learn from the experts. We want you to learn what really is PCOS, how to take care of it, how to control it, how to overcome it, and something which is not going to rule your life, but it should be you ruling the PCOS and controlling it. And this is something we all need to understand, that any disorder, any problem, it's for us to be strong in our minds and overcome the problem rather than be subdued by it. We have been connected to all our patients individually. As doctors, we all speak to our patients. We give talks. But as a society, as an organization, which is the PCOS Society of India, focusing only on PCOS and all its issues, we have come together this time and we are celebrating the International PCOS Day. And that is why our members from our society are going to address you. And we are going to do it in the form of a discussion, not really lectures to bore you, but we will have a discussion amongst ourselves and then we'll answer all the questions you may have. So this is something we are going to do. And I'm also delighted that because we have these very eminent ladies with us, one of them is a very well-known educationist, we'll introduce her soon, and one is a very well-known businesswoman. And the third person is a filmmaker, a person who has suffered herself, not really suffered, who has had PCOS, but she's controlled it. And how she's done it, what is her experience, she's going to tell you about it. So in short, I welcome all of you again once more, and do enjoy the program, which will last for approximately 3 hours. We have got awards for the competitions we held, and we have got very nice snippets, 5-minute snippets there for you. Ruby has already introduced it to you, and I think you will really enjoy our program. So stay put and be with us. See you soon. So again, it's my proud privilege to introduce to you our guest of honor, Mrs. Namita Thapar. Don't get fooled by her bubbly appearance, as she looks like a young little college girl actually. But she's the mother of a well-grown-up boy. She's a well-known businesswoman, and she's the executive director of MPO Pharmaceuticals. By profession, she's a certified chartered accountant from the Institute of Chartered Accountants of India. She holds an MBA degree from the Fuqua School of Business, that is Duke University, North Carolina. She's the founder and CEO of Incredible Ventures Limited, the master franchisee of YA, that's YEA, USA, which is in US, and it's an education company that teaches entrepreneurship to 11 to 18-year-olds, and those young kids become great business people later. Currently, YA is operational in 6 cities in India: Mumbai, Delhi, Bangalore, Pune, Chennai, and Ahmedabad. She's a great speaker. I've been one of her doctors whom she has personally interviewed, and it's well seen her channel on YouTube, where she has interviewed a whole lot of doctors and also celebrities. She does a brilliant job, and she is a person who has also addressed the Economic Times Women's Conclave, the Entrepreneurs India Summit, the Harvard Business School, and IIM Ahmedabad. So we are very delighted to have you, Namita, with us, and I request you to speak to our audience and inspire them with your story, and telling them all what you'd like to tell them at your age and their age. Thank you.
Hello, everybody. I'm Namita Thapar, Executive Director of MCure Pharmaceuticals, and I'm delighted to be a part of this conference today. Women's health is a topic that's very close to my heart. I'd like to share a couple of statistics that were incredibly shocking to me, and that's the reason why I feel initiatives like this, where we all get together to make a difference, are extremely important. In December of last year, I came across a report by World Economic Forum that studied various countries on women's health, and out of 156 countries surveyed, India ranked 155th, bottom 2 on women's health. This is a shocking statistic, and a lot needs to be done to change it. MCure, my company, conducted a survey 3 months back with 1,000 working women in 7 cities and asked various questions around women's health. I was shocked by the data and the results out of that survey. Most women still consider talking about health issues a taboo. Most women still feel that getting marriage proposals would be difficult. There would be a lot of judgment. They feel their male colleagues are insensitive. Common conditions like infertility, PCOS, endometriosis, again are considered topics that they do not want to talk about. If this is the condition of working women in metros, we can only imagine what the condition would be like in smaller cities, tier 2, tier 3 cities, with women who are not as educated, or families where they're not as progressive. All in all, what I'm trying to put across through both the survey that we conducted, as well as the World Economic Forum report that I just spoke about, is that women's health is a topic or an area where a lot of us need to come together and a lot of work needs to be done. We all know that the first step is awareness. And so I'm extremely happy that today we're all coming together to support this wonderful initiative led by my dear friend Duru around PCOS. PCOS is increasing by the day. The statistics are getting larger and larger. Women face a lot of taboos. We did an episode with Duru on my YouTube show around women's health called Uncondition Yourself. And I was shocked that there were most of the women did not want to come on the show because they did not want to talk about PCOS. Why should women who have a strong voice be afraid of speaking up? Why should they not want to talk about these issues? It all starts there. And to break these stereotypes, we need to get more educated. We need to get more informed. And so again, I'd like to conclude by saying that MCure, my company, a leading company in women's health, is proud to support this wonderful public awareness initiative. I'm proud of my dear friend Duru to take up this cause and of all the wonderful speakers and faculty who have taken out time from their schedules to work towards this important initiative around public awareness. Thank you all for your support. Thank you for making us a small part of this very important initiative. And I wish you all the very best for this, as well as all future endeavors around PCOS awareness and education. Thank you.
Ladies and gentlemen, it's my proud privilege to introduce to you Dr. Mrs. Indu Shahani, a well-known educationist who is loved by all the students who have trained under her. I have known Indu right from the time she was a young girl in college herself. I've seen her grow, I've seen her blossom, and I've seen her reach such fantastic heights today that I feel very proud to know her. She started off as the principal of the HR College of Commerce, where she really ruled the roost. And today she is currently the Dean of the Indian School of Management and Entrepreneurship, that is well known as the ISME. She is also the President and Chair, Academics of the Indian School of Design and Innovation, that is ISDI, WPP, School of Communication, and Indian School of Management and Entrepreneurship, that is the ISME. Besides being an educationist, she has been the former Sheriff of Mumbai, occupied the highermost position in the Municipal Corporation of Mumbai, and during her tenure as the Sheriff, she launched the 1298 helpline for women against domestic violence. And she was the one who worked with NGOs to take this very, very much ahead. She's the first Indian to be appointed as Vice Chair on the board of the Governors of the International Baccalaureate. Such great honors as an educationist, as a woman educationist from India. She's had many awards to her credit: the Roll of Honor by the Deakin University, the Excellence Award for Humanitarian Service by the Rotary Club of Mumbai. She's won the Women of the Decade Achievers Award by ASSOCHAM Ladies League Mumbai, Citizen of the Mumbai Award by the Rotary Club of Bombay, Excellence in Education Award at the FLO Great Women Achiever Awards, and Achiever of Excellence Women Achievers 2012 by Bombay Management Association. So a lot of credit to her. Indu, we welcome you to this wonderful gathering, and you being our chief guest, I request you to say a few words of inspiration to our audience.
Thank you, Dr. Durusha, for inviting me. It's such a pleasure to be here today. Thank you, Dr. Durusha, for inviting me for this very, very, very crucial and important webinar. And I must say that over the years, while I have been a principal, a teacher, a faculty, and now looking after so many schools, colleges, I have always come across this health issue. And this health issue has not been very well understood either by us academics or by the students. And I know that from a doctor's point of view, it would be looked at differently. But what happens to us in academics is that we often find either absenteeism in class, or we find that the students are not paying attention, there are mood swings, there is physical distress, which we are not able to identify, or there is emotional distress, and we are not able to identify that. And I think gradually over the years, I have been able to really notice this. And because I've been very, very fortunate to have great relationships with my students, I'm so glad that I recognized the PCOS problem much earlier. I knew it was a health problem. The students needed help. And I have seen that many of them who recognize PCOS early enough, they were helped by their teachers, they were helped by their parents, by their mothers especially, and they handled it much better than those who were ignorant of it. And I think today, this particular webinar should really go to many, many young people in colleges, because it's so important for young girls to understand that what happens to them is normal. It's something that can be identified, can be actually cured. A timely diagnosis is important, and I think both physical and emotional symptoms must be taken care of. And in colleges, I think with our packed schedules, with large number of students in the class, with our teacher-student ratios being so large, it sometimes becomes very difficult for us to identify students who are really going through these problems. But I'm glad to see that now more and more institutions are bringing in help for young students who have this problem. A lot of the students cope with it themselves. And I think that coping is wonderful, because then they help their friends to cope with it. But a lot of the students need help. And I have seen that even a teacher who's able to spend some time with them, a friend who's able to spend some time with them, an older person who's able to spend some time with them would be able to help them out. But we have now started keeping counselors and therapists who help them out if they are emotionally disturbed by PCOS. So I would say that I would like to encourage students to understand this problem. And I'm not only talking about students, I am talking about my young ladies who are working for me. Today in my dean's office, I have 3 young ladies. All 3 of them have at some time or the other had problems with PCOS. And I think at that time, support from the team around, support from us was so important, especially when we found that young ladies and young women had problems in conceiving. And I think that's when not only we gave them support, but I think we explained to their partners that they also need to give support to their wives, because this was something that is normal and it happens to everyone and a lot of people. And so I have gone through this at close quarters with my students and with my young people, young ladies and young individuals who work with me. So thank you so much for inviting me here today. But I am going to leave all of these young girls and these lovely young women who sometimes suffer from this problem, the health problem. I am going to say that Polycystic Ovary Syndrome, PCOS, is something which is common, and you are not alone in that. It also affects individuals differently, so please understand it. Treatments are needed. Identify your problem early enough, and you can then tailor your problem to whatever are the needs of your problem. Please also get yourself checked early, because if you are checked early, your symptoms and your risks reduce, and you may be able to overcome this very quickly. Most important, and I say this to all my students, not just anyone who has this problem, but all my young students. I say this, lifestyle management. That is what is most important. You have to see that you are eating healthy. You have to see that you are exercising, and you have to see that wherever you need help or if treatment is required, you are going in for the effective treatment. So I would say that lifestyle management, according to me, is the most important to come over any health issue that any of us face. And of course, very effective treatments are available. Can you imagine a few years back, could you get a webinar like this? Could you have Dr. Durusha available just, a foot away from you, and at a drop of just pressing your computer or your iPad and talking to her? This is something that has happened now, and make the most of these effective treatments. And finally, another thing that I tell all my students again and again and again, have a positive state of mind. Your positive state of mind will really help you to overcome any issues that you have in life. Remain positive, remain passionate about your life, and I'm sure no PCOS is going to come in your way, and I'm sure you'll do very well. Thank you again, Dr. Durusha, for calling me today, and I hope some of my students are here and they are listening to this, and I'm sure once my university gets going and is fully set up, we have just set up the Atlas Skill Tech University, India's first Skill Tech University in urban Mumbai in BKC, and it does programs in design, management, entrepreneurship, media communication, digital technology, and it's also doing film and animation and VFX. When you have the time, Dr. Durusha, please, once we are absolutely on campus, all of us, do come and talk to my students. And also, I must tell you, I've done two special things, keeping this in mind, how important it is to see that we as educational institutions, we as universities, support the medical profession by giving the right opportunities and framework to our students. So in my canteen, while they can grab whatever food they want, there is a healthy corner. And I must tell you, the healthy corner in the canteen is most popular. That's one thing we've done. Secondly, we have now created a student experience zone where students can talk to each other, they can spend some time there, there would be time for them to relax, to, we're going to be keeping some gym items over there so they can even exercise a bit. And of course, we've got a football field attached to us so that you can either have your games or cricket or football. And there is a beautiful park in front of us, which has been created for the university. And it's a beautiful walk that my students can take whenever they want to refresh themselves. So we look forward to having you all on our new university, the Atlas Skill Tech University. But till then, all the best. Thank you for inviting me, and it's been a pleasure. And I do hope that my students and my young ladies and everyone who is affected by this will overcome this with positivity and passion.
Thank you.
Now, to take the program forward, which is a panel discussion with all the experts who are invited today on this platform, I would like to introduce Dr. Anita Soni, who will be moderating the session. Dr. Anita Soni ma'am is an obstetrician and a gynecologist at Dr. L.H. Hiranandani Hospital, Mumbai. She's completed her MBBS and post-graduation from SATE GS Medical College and KEM Hospital in Mumbai. She has many papers and publications to her credit. She has won many awards in various state and national conferences. She has very special interest in the high-risk pregnancies. She is an eminent speaker at various national and state level conferences. I welcome Dr. Anita Soni ma'am to take forward the panel discussion. Over to you, ma'am.
Thank you, Ruby. Thank you for the kind words and welcome everyone. Good afternoon, ladies and gentlemen. And it gives me immense pride to be able to conduct this session on polycystic ovarian disease. इतने सारे लोग, इतने सारे opinion, Google master, everything seems to be confusing everybody here. And we have a list of people, eminent speakers who will be answering all your questions. First of all, your gynecologist, Dr. Durusha. Less said about her, the better, because the world knows her. And to me, she's like a mother figure. She's been my teacher, and I am only too proud to say thank you, ma'am, for everything that you do. The next on the panel will be our famous endocrinologist, my batchmate and dear friend, Dr. Shashank Joshi. Hi, Shashank. Welcome to this panel. It's been brilliant. You've been working in COVID. We've heard a lot about you. We've seen a lot of you. You've helped a lot of us. I learned a lot of COVID from Shashank. He helped treat me when I was down with COVID. So thank you, Shashank. Next on the panel are Dr. Trisha Parekh, who is an exercise and fitness consultant. To me, she's Trisha, and she's excellent in whatever she does. She's a perfectionist of sorts. So I'm sure she's going to do a fantastic job on discussing, explaining, and telling us what the right exercises are, whether we do cardio, whether we do, weights, what do we actually do if we are polycystic ovaries? Do you need to lose weight? Do you need to exercise? Do you need to diet? All of that we'll hear from Trisha. Next on the panel is no one other than our nutritionist, Ruby Sound. You've heard so much of her, but she's excellent when it comes to diets in polycystic ovaries. Next, you'd have Dr. Sujata. Dr. Sujata is a wellness expert, and she will be helping us understand what you do to be able to live a wellness, happy life so that you can take things forward. We also have a psychiatrist, Dr. Sapna. Dr. Sapna Mangar is a famous psychiatrist practicing in Bombay, and she will answer all your questions on mental health, eating habits, binge eating, all of that. Do you require medication? And last but not the least, you have Dr. Gulrez. Dr. Gulrez is a dermatologist. She is attached to Saifi Hospital and Gynae World. She's an expert member, All India, of the Acne Task Force. And who better than her will be able to tell us on what polycystic ovaries and acne does to the mind for little young girls and how we can deal with it. So let's start the panel today. That was an offhanded introduction to everyone. Apologize for that. But I didn't have any slide ready with me for the introduction because she was not sharing the screen. So let's officially start. Madam, Dr. Durusha, we will start with the first question. What is this bimari called polycystic ovaries, and why is it affecting just about all and sundry today? Why are girls coming telling me, hello doctor, I got polycystic ovaries? What is all of this? What is the difference between PCOD and PCOS? Does everybody require treatment?
Okay, too many questions all together, but I'll try and answer them very, very briefly. First of all, I'd like to talk about why really we call it PCOS and not PCOD. PCOD stands for Polycystic Ovarian Disease, which we have actually continuously, sort of currently decided not to call it, because it's not a disease. We call it Polycystic Ovarian Syndrome. And this is something because every girl or every woman who has PCOS presents herself with different manifestations. Some of the girls are obese, a lot of them are overweight, 80% are overweight, there'll be 20% lean, there'll be some women with cosmetic issues, there'll be some women who have got problems losing weight, there are some who are losing hair from the scalp, some who have got irregular periods, and some who have got problems with pregnancy, difficulty conceiving. So there are so many different ways they present, and therefore each one has different stories to tell you. But in short, they come under the banner of Polycystic Ovarian Syndrome. And this is something what we call PCOS, and that's what it is about.
Thank you so much, madam, for explaining that PCOS is the right terminology. Some radiologists would say polycystic ovarian disease, and they label the patient with who has absolutely no symptom. So you need to test all of them. And what are the tests that we should do for these girls?
Anita, first of all, you are completely awesome, and you have not changed in the last so many years I have known you. I must thank you.
No PCOS.
I cannot say no to Duru madam. I am the only odd man out here, and she never leaves me with a choice. So thank you so much, ma'am, for including me always in all your programs. I'm in this PCOS society only because of ma'am, and we all love her, and she's like a mother figure to all of us.
Oh Lord.
And that's the truth. So let me confess that. We really admire her abilities, her articulation, and very rightly she has said that we don't label somebody with a syndrome or a disease till 18, but there is an entity called adolescent PCOS between 12 and 18. What is happening is these girls are often putting on weight, they are getting cosmetic issues like acne, hirsutism, which are signs of androgen excess. They are getting metabolic issues where they are sometimes getting this thickening of skin and darkening of skin around their neck called acanthosis. So couple of simple tests which we always do are the sugar test, that is fasting blood glucose with lipid profile. Insulin is preferable, but not, it's a desirable test. Not everybody needs to do it. We always do a thyroid function test, T3, T4, TSH. If you go to a lab like Metropolis, they have a PCOS profile. So we can do a simple PCOS profile. But then we often do the FSH-LH. Then apart from the FSH-LH, we sometimes do prolactin. And then we do the androgen test. Now all the androgen tests are not needed. For example, we have androstenedione, we have free testosterone, we have dihydrotestosterone, we have 17-hydroxyprogesterone, we have DHEAS. The list is endless. So where do we draw the line? You see, because we see all state of society, and sometimes they come with a gamut of tests. So it has to be basically based on the clinical profiling, and there are several types of PCOS. So fundamental to everybody, do a simple fasting blood glucose with lipids for the metabolic issues, do a simple TSH, FSH, prolactin, and maybe a free testosterone with a dihydrotestosterone will give you reasonable. If you are suspecting an adrenal disorder, then probably we may have to do a test like 17-hydroxyprogesterone, DHEAS, and so on and so forth. So it has to be an individualized decision. And many a times you might be able to diagnose PCOS, as madam said, with the Rotterdam criteria, just by simple, irregular cycles, a little bit of acne and hirsutism, and maybe sometimes a little bit of aid from sonography. So hormonal test is not mandatory for a diagnosis of PCOS. It's a clinical diagnosis with 2 out of 3 criteria, which does not mandate it. But it is always preferable to do them because it gives us a directionality on the treatment aspects. And simple things, whether it is lifestyle, weight loss, or sometimes we have to give drugs like metformin, then it gives us an aid. So all these are ancillary tests. These are not mandatory tests. They should be done under medical supervision, and they should be carefully chosen. So it is not like one size fits all. There are multiple phenotypes of this PCOS. Some are lean, some are obese. So we have to really carefully select and then decide judiciously which one to use for whom.
I would so love the way you said it, that there is no one size fits all. PCOS are big PCOS, fat PCOS, lean PCOS. So you would rather go individualistically than go across the board and check everyone. You have patients today now coming to the OPD saying, "Arey madam, I have got PCOD. I have PCOS. What test should I do?" That was the reason I said, let's hear it from the experts. What do you do for them to help them diagnose? And going on to the next thing, ma'am, if you have a young adolescent girl, Dr. Durusha, who presents to you in the OPD saying, "I have PCOS," would you directly put her on hormones, oral pills, or would you go very slowly with diet, exercise, and then look forward whether you need to put her on medication right from the start?
Absolutely, patients right and decide what you need to do for them. So it's like if she's overweight, I would definitely tell her lifestyle changes, eating a healthy diet, exercising. But that doesn't mean a lean PCOS I would not do. Even a lean PCOS needs to exercise, she needs to eat right. So, every woman or every girl whom we see, an adolescent girl, as you say, we have to treat correctly. But if I have an adolescent girl who's been having no periods for 3 months, and then she comes with profuse bleeding, which brings her hemoglobin down to almost 7 grams. So that's affecting her quality of life. In such patients, I will intervene. I will give her something so that her periods start coming a little bit more regularly and she bleeds less. I would investigate her as to finding out what is the cause of her irregular periods, what are the issues she's facing. Based on those tests, I would decide how to treat her. She could be hypothyroid. We see so many PCOS girls who have got thyroid issues. So simple tablets of thyroid can help her get well. So I think it's important to reach the right diagnosis before putting them onto any hormonal therapy.
I couldn't agree with you more. Now that we've been talking about the adolescent girl, can we ask Dr. Gulrez, what do you think of this black patch called acanthosis nigricans that these girls come to us with? Do we really need to investigate all of them? How do you think we should treat them, along with if they have a little bit of acne?
So thank you for having me on this panel. It's a privilege. The acanthosis nigricans, as the previous panelists mentioned, the dirty looking neck. This hyperpigmentation not only nowadays occurs on the neck, but also on other body fold areas. We see it increasing on the knuckles of an individual, the cubital fossa, which is the fold between the forearm and the upper arm. So these are all the places of manifestations. There are more. This is basically an indicator that a person could be having insulin resistance, which is the main basic pathology, the pillar pathology in a patient of PCOS. So with the obese, we of course mention to them that the lifestyle management will, when they reduce their weight, the pigmentation would come down. But even the lean patients who have acanthosis, we have to kind of look for their visceral obesity, the abdominal fat, and guide them accordingly on lifestyle, basically nutrition as well as exercise. And in children, basically, the dermatological treatments do not really help. But however, we do prescribe certain creams and do certain procedures like something called as TCA peels. We do certain laser treatments which could help to reduce the pigmentation, but the way in which it would come down would be to correct the underlying insulin resistance, and that is achieved with lifestyle. There are drugs though, but we would refrain in adolescents unless it's really mandated.
Yeah. We'll go back to that. What is this hyperinsulinemia? What has insulin got to do with polycystic ovaries? Insulin was released by pancreas. Polycystic ovaries is ovaries. How are these two related, Ray?
So, Anita, the simplest explanation for that is PCOS is diabetes of the ovaries. Okay, that is a lay people way to explain it. As Gulrez was saying, insulin resistance is the key. And you are right that beta cells make insulin from the pancreas. But the function is that insulin is like a coolie which picks up the glucose from the blood and puts it inside every cell. And ovary is no exception. And ovaries have two primary functions. One is to ovulate, and second is, of course, to regulate overall the estrogen and the femininity, etc. So obviously what happens is when the insulin receptors on the ovaries are disordered, you get insulin resistance on the ovaries, which manifests as PCOS. Whether you are lean, whether you are obese, it doesn't matter really. And that is the crux. And this whole insulin receptor, post-receptor defects which are there, they are causing this whole so-called ovarian diabetes or ovarian insulin resistance, which has all these different constellation of symptoms. Some will have acne, some will have hirsutism, some will have little thinning of the hair and they feel they're getting bald. Some of them may be completely normal, but just have a little irregular cycles. And some of them may just come to you with infertility. So obviously we need to get that sorted. And I hope that though insulin is totally independent of this, it is the action of insulin on the ovary, which is one of our reproductive organs in women, is crucial. And therefore, these are the receptor post-receptor defects of insulin signaling, because ultimately insulin is like a lock and key. It is fundamentally opening the lock of every ovarian cell, whether it's a theca cell and so many follicular cells, and they're opening these cells so that they get glucose for their energy. Unfortunately, the locks are clogged, just like our doors are clogged in monsoon season. And that's what is happening with insulin resistance. And that is how insulin, diabetes, endocrine, everything gets linked to this whole gamut of PCOS.
Thank you, Shashank. Now, Ruby, everybody's been talking about diet. There are so many fads about keto diet, intermittent fasting. What is it about diet and PCOS? Can you please tell us something?
Thank you, Dr. Anita, for asking that question, because I'm sure every patient coming to you must be asking what is the right food to eat. Like y'all have been discussing that every case is different. Same way, every PCOS girl has to be given a different diet, because either she may be thin, okay, or she may be overweight, where we need to help her lose weight. She may be in a preconception, prenatal stage, where we need to consider other things, or she may be in the first trimester conceive, but she has a higher risk of gestational diabetes. So we need to consider many things before we take care of a PCOS patient's diet. But fundamentally, we have to deal and correct one thing, which is insulin resistance. So when we look at the diet, we need to make sure that the foods which are going to make sure that, because of insulin resistance, your carb intake doesn't lead to worsening of it. So selection of food should be selecting foods which are lower in glycemic index. In simple terms, if you have to choose wheat and maida, you will be taking foods which are made up of wheat flour only, because that is lower in glycemic index. That doesn't raise your blood sugar level. If you have to choose between a fruit and a fruit juice, it's better to opt for a fruit which has fiber and will not release sugar immediately. Same way, rice is not a no. You can choose brown rice or a parboiled rice instead of a white rice. Not only carbohydrates are important, because we eat a lot of roti and rice in our meals. We also forget to have enough proteins in the diet. So every PCOS woman, we ensure that she consumes protein of good quality, class 1 protein in every meal. Preferably begin the meal with protein. So whether it is lean chicken, fish, eggs, even nuts give you good amount of proteins. All the milk and milk products, including curd, is a good option. Dals and pulses also give protein. Soya also gives you protein. So protein is an important part. Coming to the fats, it's important to select the correct and the good fats, especially if you have PCOS, because there's a lot of inflammation in this. So we need to ensure that we do not use the refried oil. Once we usually at home, there's nothing is cooked specially for on in a different oil. Once an item is fried, that oil has been reused again and again. So we make sure that none of the PCOS patients use the reused oil again and again. And use of good fats like olive oil, rice bran oil, or nuts can be a good choice for these patients. We should not forget water as one of the nutrients, because either they get periods after a very long gap and they have cramps and they're unable to, and they bleed very less sometimes, or they bleed excess. So water can play a very, very important role, which we forget. We need to ensure that the patient takes a lot of water also. So each PCOS patient who comes to us is given a diet plan which is tailor-made for her, keeping these points in mind.
Dr. Sapna, just coming back to you, tell me something. We're talking about ovaries. Is there any connection between polycystic ovaries and mental health?
Thank you for having me here, Dr. Durusha. I think we've been working very closely with Dr. Shah because, there is a lot of vulnerability in this population with adolescents, young people women who have been diagnosed with PCOS, or as we are saying, younger people who are at a risk of being diagnosing with PCOS and mental health. They are, it's not that everybody will have mental health issues, but our research shows, as well as our clientele show, that they are 3 times more likely to have anxiety, depression, stress related issues, and majority of them do have body image problems, because as we are seeing, there is so much of cosmetic issues involved in this disorder, that most of them do suffer from body image issues, feeling that they are not, desirable, that they are not attractive. There is a lot of, eating problems. So disordered eating, mainly in the binge eating and bulimia category, and then alternating with restricting diet. There's also something called obsessive compulsive disorder, which is seen in a higher degree in people with PCOS. In fact, we have seen quite a few of young people even coming sadly with suicidal thoughts, because they feel that this is, the end of their life. They don't feel that there is hope remaining for them, because there is, as we are seeing, there's so much of social media information, Google information. It is associated, as soon as you say PCOS, the first thing that comes to mind is infertility. So there is so much of myths around this disorder, that young people need to be educated, and a lot of mental health issues and problems arising because of that.
Thank you, Dr. Sapna. Dr. Sujata, what do you think is the role of some kind of a wellness coach or a lifestyle coach that can help improve, or is there any role, or is there anything that you would like to advise patients with polycystic ovaries?
Yes, thank you so much for having me on the panel today. I think with a PCOS diagnosis, yes, it's a complex disorder with a variety of manifestations. But one of the things about it that struck me is that, young people take their health for granted. We have one body and we have one mind that we have to look after for the rest of our lives. And there was this one really poignant research that was done on World War II soldiers, young men, like 18, 19 years old. And they studied their hearts after they had died, and they found that atherosclerosis had already started to develop. So heart disease had already started to develop in very young men. So we really start to age from the time that we're born. And it's very important to look after your mind and body. And I think for young women who've gotten this diagnosis, it's almost like it's a golden opportunity to wake up and look after your nutrition, your exercise routine, your sleep, and your mental resilience. Because you need mental resilience to combat the stress that you're going to have to deal with for the rest of your life. Just as you're going to have to look after your body well, just as you need to do exercise, you need to take care of your nutrition. And everything that the nutritionist just said about eating complex carbs, lean proteins, staying off sugar, having a diet that's rich in fresh fruits and vegetables applies to all of us. So even if you don't have a PCOS diagnosis, you need to eat right. And if you can inculcate the habits from the age of, from being a young teenager, you're setting yourself up for a life that's going to be really well lived, because it's almost like a red light, right? PCOS is like a red light that's come in the highway of life. And if you look after yourself at that point, the rest of your journey is going to be smooth.
Fantastic, Doctor. Tuvisha, coming to you, they're all talking about exercise. What is the role of exercise in polycystic ovaries, and which exercise are you supposed to do? Are you supposed to run miles? Is it good enough to only walk? Are you supposed to lift heavy weights? What does one do to lose this goddamn weight?
Thank you very much for this question, ma'am. And very rightly said, it's always confusing for PCOS patients and in general for people as to pick what type of exercise to do. And taking the chain from what Dr. Sujata mentioned, that, not just for PCOS girls, in general, for a good life, we need to do certain things. So from that point of view, we just need to exercise first, and we need to do all varieties of exercise. Aerobic, which means you're running, jogging, walking, swimming, cycling type of exercises. Resistance exercises or strength training exercises, which means lifting of the weights, and flexibility exercises. So in general, everybody needs to do this. But now coming to PCOS in specific, why is PCOS specifically recommended as a treatment modality? Like Dr. Durusha also started off mentioning that even for lean girls, we would still recommend exercise. And that lies, the crux of that lies really in the hyperinsulinemia that we've been talking about, which improves massively. The insulin resistance benefits greatly with exercise. So that's one of the cornerstones of exercise being beneficial in PCOS. And now most of the studies have been done on aerobic exercise like walking, jogging, and they've shown that yes, it definitely benefits PCOS. There has not been enough research done on resistance exercise. However, there's been a lot of research done on diabetes and resistance exercise, which they have shown is beneficial, and which they have shown diabetes benefits because it improves insulin sensitivity. So applying that same principle in PCOS, we can say that yes, definitely resistance exercise will also help in PCOS. And practically, I have also seen, and we've all seen, that it is a combination. But as a bottom line, what I would say, when people have all these questions, I would say, do something, do exercise, something that which you can do regularly will be the most beneficial exercise for you. In that gambit that, oh, today it's raining and, aerobic exercise, research has shown aerobic exercise, walking, jogging, it's raining, so I will not go for exercise for the next 1 week, or because of which I was not able to exercise for the last 1 week. No. If you do something at home, even if it's few jumpings or some weights, it will still be beneficial. So I think in the practical scenario, anything that you can do regularly, yoga, whatever, any type of exercise, 30 to 45 minutes, what you can do regularly will be the most beneficial for this person, is what I would say.
Thank you, Twisha. I was actually going to ask you, how much exercise is enough? Is it dependent on the size of the patient, the height of the patient, the weight of the patient? Or is there something across the board that says you need to do that much amount of exercise to be able to help yourself?
So you're right, ma'am. When for weight loss, the criteria, the international criteria by the American College of Sports Medicine does say that for weight loss, you actually need to do 120 minutes of exercise per day. Which is a fair bit. That is the international guideline, which is a fair bit. And having said this, please let's not ever recommend our patients to go and do this upfront, because then they'll end up with aches and pains in the body. But ultimately we want them to achieve this. So that is there. That's the ultimate criteria. Having said that, it's always good. Minimum 30 minutes is kind of necessary. There have been some solid papers in 2020, 2021, which have come out to saying that 120 minutes of vigorous exercise is what really benefits the PCOS patient. So now it's not in the duration of exercise, but also the intensity which comes into play. So, with exercise, exercise is like a medicine. Just like a medicine will have its 50 milligram, 75 milligram, twice a day, thrice a day. The same thing with exercise. You have your low intensity exercise, moderate, high intensity exercise. So a lot of research show high intensity exercise is very good, beneficial in insulin resistance. But the problem which comes up with that is people land up with aches and pains. And as a sports and exercise medicine doctor, I also see injuries. And that's one of the foremost reasons people actually come to me, is because they've started an exercise program and they'll land up with an injury, and then they go on a layoff of 2 weeks, 3 weeks. So that is actually more detrimental when those 2-3 weeks, when you're not even going to climb that 2 flights of stairs of your compound of your building, which you were otherwise going to do. So being physically active is the foremost thing. Reducing your sitting time, being physically active is the foremost thing, which should not stop at any point. Starting slow, starting with 30 minutes and going on to 120 minutes could be the goal. And intensity also the same way. Starting low intensity, ultimately when your fitness builds up, going on to high intensity exercise, because that is what is going to achieve long-term compliance with exercise also without a break.
Now that we've been talking so much about PCOD, can we go back to Dr. Durusha? Madam, all these girls, do they have treatment modalities available for them in terms of pills? Should they all go on oral contraceptive pills? Who are the patients that you would advise? What are the medicines that you'd like?
Okay, there's no one treatment for all, as we have talked before. It all depends what she's come to me for. If a girl comes to me because of the irregular periods, And if she's still very young and I don't wish to give her oral contraceptives like combined hormonal, the two hormones together, I would probably just give her one hormone, make her get a withdrawal bleed, means get a period, create a period so that she doesn't bleed heavily after 3 months of no periods. That's, of course, keeping in mind that lifestyle changes have been initiated, right? Reducing weight, etc. The second thing is that if she's come with a lot of cosmetic issues like acne, etc., yes, a combined oral contraceptive pill is great for her. It makes her get her period on time. It gets rid of her acne. It reduces the amount of blood loss, and it helps her tremendously. And if she's sexually active, it works as a contraceptive. So that is a second thing. If she's insulin resistant, then I like to put them on metformin, which is an insulin sensitizer, and that helps the insulin to work better. The biggest, drawback, not drawback, but misconcept is that if I take this, am I going to get, blood sugar will drop? That is something they don't need to worry at all. The blood sugar doesn't drop because of that. And therefore, I think women or girls need to know that when they are given metformin or an insulin sensitizer, it's something they should be taking very happily, because that will reduce the insulin. It will help them to lose weight better when they are exercising, and it will help to get rid of all the cosmetic issues or pigmentation they are having. They're able to lose weight better. With that, the periods start coming on time. I think it overall helps tremendously. If they've got high male hormones, then we have medications to reduce the male hormone. I think we've got tremendous amount of therapies available to us. So,
Can't agree with you more, ma'am.
And if they're
lots available.
And if they're infertile, there's so much we can do for them.
We'll come back to the infertility. Now we're still dealing with the young adolescent PCOS. Shashank, everybody seems like your fancy metformin is the answer to lag dukho ki ek dawa type. Do you really suggest? You have patients coming and asking, "Arey doctor, ye to diabetes ka dawai hai. Will I become a diabetic because I'm going to take this? Do I get loose motion?" What's your opinion?
So as Guru Madam said, Anita, that this is one pill which fits all, including lean people, because there is insulin resistance at the core. And metformin is, sasta and majboot. It's economical, it's off patent, it has to be given after food, you can give it sustained release. Yes, occasionally it can cause GI intolerance. Sometimes you may get a ghost pill in the stools and you get a frantic call that, somebody had the tablet in the stools. So all that can happen. But I still feel metformin with lifestyle, positive attitude is the way to go for PCOS, because it is treating the core of PCOS. And therefore it is the real, it improves fundamentally the insulin action. And it's a very old medication, Anita. It's more than, 60, 70 years old. And it's been time tested. It's not just used for diabetes. It's used for pre-diabetes. It's used for people with now even for cancer. You see, it has more than 100 uses. And PCOS is one of them. And it's very safe. So there is nothing to fear about. The only challenge is in India, we get these strict vegetarians, pure vegetarians. And secondly, if there is a GI intolerance due to metformin, we have many other insulin sensitizers which are available now. But most of them are emerging in research. For example, we have a glitazone which makes you put on weight, like pioglitazone. And then we have a saroglitazar like medicine. Then we have, some of these new GLP-1 analogs which can be used. So we have a lot, as Madam Duru said, we have a gamut of new molecules which are there. And then we have these nutritional inositols, myoinositols and dichloroinositols, which can improve insulin signaling. But I think metformin is economical, it's widely available. In fact, one famous global expert said that, you should in India have water, fortified with metformin, because of the high prevalence of diabetes and lifestyle diseases we have. And that's a little too much. But I think in the PCOS context, from insulin resistance, I think it's a panacea for all pills. And you need to be very careful that sometimes, you can get occasional GI intolerance, but I think we have alternatives for that also. So I think metformin is something which we can give and we should give. And we routinely use it. and it continues its use to improve ovulation and correction of cycles, even if somebody is into a fertility situation. So although it may not be the best science, but it has a role clearly. It also prevents diabetes. Remember, the globally approved drug for diabetes prevention is metformin apart from lifestyle. But please don't take away lifestyle. So it works best with lifestyle. And remember, metformin works at bedtime. So it is also called metformin. In France, they often give it at bedtime. And a lot of people don't know that. Actually, if you are giving 1.5 grams of metformin, it basically works on switching off the glucose diarrhea of the liver. So it works on the liver insulin resistance, which is the mother apparatus of our body, our metabolic organ of our body, which really pumps out glucose at night. And that's really the switching off of that hepatic glucose diarrhea at night is done by metformin. That's why it is called as metformin. And it's actually a French invention. So French scientists used to give all the metformin at night, and then they never puked. So we really wondered why they never puked. And they used to give 2 grams of metformin twice a day. So that was like industrious doses. Now we don't give such high doses. So remember that metformin is a pill which has been used for more than 60 years. It has been very well evidence-based. It has robust science in diabetes and prevention of diabetes. It has very good science in PCOS also. And it's best given at night, at bedtime, but always give it after meals, never before meals. It can cause occasional GI intolerance, but it's a wonder drug.
I can't agree with you more, but I need to know what is the dose to give. You said all nice things. How much to give? It's available 200, 500, 850.
We can start with 500 mg 3 times a day, but the PCOS approved dose is 850 milligrams 3 times a day. But that is for a Caucasian, and therefore in India, everything is a little less.
Lesser.
So we start with 500 milligrams 3 times a day, and you can go up to 850 milligrams 3 times a day. You can go up to easily 2 grams a day.
Thank you, Shashank. Thank you for clearing out our doubts on the dose of metformin. Now we must go to Dr. Gulrez and ask her. All the patients come crying, I got so much of hair on my face. If I shave it, it gives a green stub. If I bleach it, it does not help. Vaccine is not helping. What, in your opinion, is the right treatment for hirsutism associated with polycystic ovaries?
Well, I think if the hirsutism is local, restricted to certain areas, then the physical methods of hair removal, and in today's time, it is the laser hair removal that works extremely well. However, one must not forget that laser hair removal is not the treatment for hirsutism. In the sense, it is a hair reducing. It causes permanent hair reduction. So all the words are important. It's hair reduction and not elimination. And of course, the hair reduction is permanent, but the residual hair, which are finer and thinner, are left behind even by laser. So, I like to explain it like this, that the hormones in a PCOS girl or woman causes the hair growth, and the laser tries to remove it. So it's like a tug of war between the hormones and the laser. Frankly, in such individuals, I would say that there is no real end point for the hair removal. It kind of goes on, and maintenance sessions after effective reduction of hair has taken place, maintenance sessions need to be continued for a long time.
Is there any age, after which you can start laser, or even for the adolescent children, you'd allow us to use laser?
So generally, technically, based on our scientific papers, we say that 16 onwards is a safe age to start with, because during adolescence, the hormones are, kind of raging, and once that is stabilized, it's best to start the laser hair treatments for better efficacy and effectiveness. However, there have been times when there are much younger girls coming to us with a lot of hirsutism, they are brought in by their parents because they are obviously psychologically affected by the excess hair on certain very obvious areas of the body as well. And we do make exceptions with the compliance of the parents and permission of the parents. Yeah.
So you say it is individualistic. There is no real right age. You'd like to 16 for 16, them to complete. But otherwise, there are exceptions who are getting very upset. You can take permission and go right ahead. Dr. Sapna, why is this PCOD associated with anxiety, depression, and all these things? They are young girls, they are young children who are, leading their normal lives. What would you suggest for these?
As we are hearing from all the other, experts, that there are lot of hormonal changes. So the two reasons why mental health issues, especially anxiety and depression, are common is the biological reasons, and then there is the psychosocial reasons. So the biological reasons, as we are hearing, hormonal changes, hypothyroidism, possible insulin resistance, high cortisol levels, all leading to stress. So we all know that high cortisol is associated with stress, and low serotonin is associated with depression. So, these are the biological reasons why people might be undergoing or feeling anxious or depressed. But then there is also that massive psychosocial aspect of the disorder that is there. Because women question their own femininity because of it, because we know that there are high levels of male hormones. So, when you have excess hair, when you have hirsutism, when there is a risk of infertility, when we are talking about black patches, cosmetic reasons, low self-esteem, most women will have low self-esteem because they don't see themselves to be desirable. There are a lot of questions about why me? Why does it have to be me? There is social isolation because, for younger children, younger adolescents, as we are seeing, probably they might be undergoing bullying because there is cosmetic reasons associated. They feel very isolated. They feel at times they are body shamed for some of these symptoms that they have. They don't know where to turn to. They don't have, a support system around them. So there are various reasons why women especially and younger adolescents might be undergoing, anxiety and depression.
Ruby, while we're at this, what do you think, I have a question here that says, during lockdown, I did keto. My periods became normal. I started eating after lockdown, and now I've become fat again. And my periods have become irregular. What would you suggest for her?
So like this girl who has put this question, this is very common for a lot of people. Whether it is keto diet or any diet, these are short-term fat diets. Especially these diets, when we're talking of keto diet, it is a very, very high fat diet, okay? Where your carbohydrates is less than 50 grams, but your fat intake is more than 70 to 75%. And this will actually help you in combating the insulin resistance for a very short time. Because at that point in time, the body is not using anything else but the body's fat as a source of energy. Now lockdown was there was hardly any physical activity. They experimented with a lot of cheese, fat, butter, everything out of excitement and quick weight loss. I'm sure this girl must have lost a lot of weight like others. But over a period of time, eating a keto diet is also not very pleasing, so much of fat, butter and all that. Over a period of time, it becomes very difficult and there's no fiber in the diet. So constipation comes into picture. Then you get something called as keto flu because, you smell different when you are on such a high fat diet. Over a period of time, weight loss is done. Now I can eat anything and everything. Gradually, this girl must have, stop following the keto diet. And then you see what? Regain of body weight. So now even if she tries again, it's what is she regaining now is the body fat and not the muscle. For this person, it is very, very important like others to do lot of exercises at this point in time. Because all that she's accumulated now or regain of weight is the fat. So she needs to burn the fat not by eating fats now, but by doing a good amount of exercise. And eat a very, very well-balanced diet. That's the only way. So my advice to all of those who are doing keto diet, if you are doing such a fat diet, it should be only for a few weeks, not for an entire lockdown like a thing. Because that's not a permanent solution. A balanced diet is the permanent solution for it. So best wishes to you. I'm sure you will do exercise and you will lose weight.
Risha, coming to you here, you have what 100 days challenge, you have 10,000 steps, you have yoga where you stretch your limbs. What do you do? How much do you do? For how long do you do? And what would really help with weight loss?
On the 10,000 steps thing, it's basically if somebody ends up walking 10,000 steps a day, it's a great, they are ensuring that they are not remaining sedentary. So definitely that's a great thing, and it should be a target. But then people very often they get bound down by these steps, and they become a little nervous if they've not completed these steps. So that counseling needs to be done. That that figure has been set a little arbitrarily. It was not that it was set slightly arbitrarily. So, but essentially, if you're doing that, you're kind of ensuring you're not remaining very sedentary throughout the day. And if somebody is doing just a run, at one particular time of the day and trying to accumulate, and then rest of the day still remaining very sedentary, that doesn't help. So that research has been done that sometimes people feel, oh, aaj to gym kar diya, then I need not climb up the stairs, need not walk to the car. I can now happily, because I've just done that 1 hour of gym in the morning. So that attitude shouldn't be there. So with that 10,000 steps, with the 10,000 steps, it's also necessary to ensure that you are doing 10,000 plus your routine activity, but again, not get bound down by the 10,000. So I'm sure Dr. Sapna would agree that these people also, once they get into activity, they get too bound down by the figures. So that's not to be done. As regards the 100-day challenge and stuff, they are the scariest bundle according to me, because they suddenly pump up and they suddenly want to do things which lands them into injuries. That's the biggest problem I see, that they'll end up in injuries. And maximum people, a good chunk of people, because they are overweight, then their body is not able, their muscles are not so strong. So that's why the resistance exercise or the strength training is very important, because your body, your muscles should be able to support the weight of your body while you're walking and doing those, any kind of aerobic activity as well. That's why the combination of strength training and aerobic exercise is necessary. Coming to the yoga question, if we really see in the true sense, yoga is considered a way of life, and it's not just the asanas. It has the multiple pillars. So, if you're really, of course, yoga asanas by themselves are also great, but if you're really going to do yoga in the correct way, employing the dietary principles and the way of life, that literally covers all the panels, most of the panel things here, if you really adopt the true sense of yoga. So that's obviously a great way to go. People think yoga is more about flexibility. Yeah, because it works. The way it works is, they say that you first, nimble up your joints, and then you get on to doing exercise. That's the way it goes. But yoga is not just flexibility. Once you progress ahead, there are challenging asanas which demand a lot of strength. So I think people in our place situation just start off yoga and then they quit at some point. So they just do the flexibility part of it, and after that they basically quit yoga and jumped up onto something else because it didn't work or something. That's what happens. But any form of exercise which is done regularly works. That's my bottom line, honestly.
So the bottom line is, you just exercise. Amongst us, we have an absolutely very strong yoga proponent who is sitting there quietly, Dr. Shashank Joshi. I think he spends half his morning doing yoga, and that's the secret. He's just the same from 1984 to date. But now we've spoken so much on exercise and diet. How about going to our...
Anita, half a minute I want. Yoga actually is silent. And, it's unique. It means to unite our body. It's really the perfect mind, body and soul exercise. And it has multiple components. One is the cleansing component like dhauti. Then are the postural exercise like the asanas. Then are the breathing exercises which are pranayamas. Then you have dhyana, which is meditation. So there are 9 types of yoga. So, people misunderstand it. Second problem is, it is not for impatient young people. You see, people are restless. They want overnight results, what Tisha was saying. And, you can't do that. Yoga is slow acting drug. It really sees its best effect after 9 months of gestation. So it takes 9 months to see the best effect of yoga. And therefore, you need to understand that you need a lot of patience, which unfortunately the Gen Next doesn't have. But it's absolutely a complete holistic way of life. I just wanted to butt in just for that.
It's not the metformin of polycystic ovaries, but we're good. We do understand that yoga is great for polycystic. And like everybody said, we need to kind of find a rhythm amongst us. Having said that, we need to know what is about wellness and what it is that we would do for obese patients as far as the wellness goes to be able to help them. So, Dr. Sujata, will you be able to answer that?
Yes, I think again, those 4 pillars become crucial, right? Whether it's exercise, and obviously if you are overweight or obese, the exercise needs to be slowly ramped up to a level like the physical trainer expert said, about 120 minutes a day would be amazing of strenuous exercise if you can achieve that. And then the nutrition piece becomes crucial as well. And with nutrition, we're talking about a diet rich in fresh fruits and vegetables, lean protein, zero sugar. I'm a huge proponent of zero sugar, and complex carbs, because you can't really do your, have a life without carbs, unless you're on a fat diet, which you don't want to be. We want to build habits that you can use for the rest of your life. Sleep is very important, particularly for adolescents. They need their rest. We all need our rest, but they especially do. And with their social media and with their gadgets, that can be compromised. So they need to be aware that they need to look after their sleep, protect it, get a minimum of 8 hours. And then the mental resilience piece, right? So recognizing that stress is a part of their lives, and they can do something to protect their mental health. Anxiety and depression are unfortunately concomitant conditions when it comes to PCOS. So they particularly, this again for me is like is a way to build habits, right? Build habits of mental resilience that they can use for the rest of their lives. So getting older is like anything else. To make a success of it, you've got to start young, and here they have the opportunity to do that. But yes, again, so it's quite straightforward, not easy, requires a lot of encouragement and support, but it's definitely doable.
Madam Dr. Durusha, now that we heard so much about the adolescent, let's go to the next age group, which is the reproductive age group. What, in your opinion, does polycystic ovaries always cause infertility? I have a question from one of the girls who's asking me, will I have children?
Yes. Again, because of my cough. Sujata and me are sharing the same problems. Anyways, when a woman has a problem conceiving, I think, and if she has PCOS, I find her the easiest to treat. Because all you have to do is correct her hormones, get her back into shape in terms of losing the weight, help her with whatever medication you can to help her to lose weight, and give her all the guidance and the counseling. And if she's quite, takes your advice very well, you won't believe it, she spontaneously gets pregnant. Honestly, I'm telling you, they don't need to do much. But if there is a situation where she's got too many issues, she's got problems with, her period, she's got problem with her hormones, she may have high male hormones in her body, she may have insulin resistance, all that, even after you correct it. And then if she doesn't conceive, then of course we help her with medications to help her to ovulate, to release an egg. If that doesn't work, then we help her to, go with injections. And if that doesn't work, then we have some surgical procedure which we can help her with. That doesn't help, then of course IVF. The question is, what should we do when? And if a woman is young still, she's just about 27, 28, and she's got time to go, we can try experimenting all these things over a period of time, and within a year or year and a half, she should be pregnant. If she's lucky, she gets pregnant immediately in the first of 2 cycles. But if a lady is, say, 34, 35, I would not want to wait too long, because every woman is born with a limited number of eggs in her ovaries. Though women with polycystic ovaries have lots of eggs. We always tell them you got lots of eggs. But that doesn't mean that they can conceive better with them as compared to a non-PCO woman. It's been shown very clearly, evidence is there that after the age of 40, both a PCOS woman and a non-PCOS woman behave the same. Even though a PCOS woman may have many more eggs, but if she's trying on her own, the chances of her getting pregnant is the same as a non-PCOS woman. So the only advantage she has sometimes is, that if she's stored her embryos, if she's had the IVF done, she's got too many embryos, frozen them, then she can keep trying, and then, that's an advantage to her. So fertility treatment in PCOS patients is very satisfactory, very satisfying. And I think all of them should understand that it's not difficult to treat. You need to be on the right path, that's all.
Thank you, ma'am. I'm sure people are going to get really reassured and not fear PCOS like a big disease and label themselves as infertile. Shashank, what do you think that once she conceives, does she all of them develop diabetes? Does she require insulin throughout the pregnancy?
Not at all. In fact, most PCOS women don't do it. And most of them deal with lifestyle. Some of them need monitoring, careful supervision. Many of them can continue their metformin, and some of them do. So I personally feel that the pregnancy diabetes 90% can be managed by something called as very good medical nutrition therapy. Only thing is that the glucose targets are tighter. Also, a lot of people confuse PCOS with diabetes in pregnancy. That should not be done. Somebody who is taking metformin conceives should not be preconstituted that she's a diabetic. And unfortunately, they label her as a diabetic, and it's a wrong label if you ask me. So that is also very important to recognize. Yes, there is some degree of overlap. That overlap is to the tune of only 20 to 30%. So only 1 in 3 women who are with PCOS may have a likelihood after 20 weeks to develop some degree of glucose intolerance or prediabetes. So that little care is needed. And as I said, eat slowly, eat on time, split each meal with 2 hours. That's all you need to blunt that prandial curve. So a lot of simple tips with positivity is all you need. Some degree of metformin can be allowed, and occasionally you might need to give insulin. But as I said, not everybody needs insulin. What you need during pregnancy is positive attitude, close monitoring, controlling your mind, your food habits, your physical activity, and staying happy. So healthiness and happiness are very important, because that's why you have this whole constellation of all these wonderful experts of multiple specialities. But in pregnancy, it is not feeding for 2. And that's very, very crucial. And unfortunately, PCOS often get construed as diabetics. And I think that misunderstanding should be removed.
Thank you, Shashank. Ruby, what is the best PCOS diet in pregnancy? Keto diet, so they cannot do. So there has to be something that they should be allowed to eat, so that they don't get diabetes. What do you suggest they do?
So I think Dr. Shashank Joshi sir has given some, he touched upon this topic. It's not so difficult because you're trying to maintain your blood sugar levels under a certain range. And to do that, you need to eat in a portion controlled manner. So some food which you're allowed to eat, even if it's a healthy food, if you overeat, then your insulins will increase, and that's not going to help you. So whatever is included in your diet, which is the healthy option for you, it has to be split into 2, like so rightly said, so that you're eating lesser, so lesser insulin rise, lesser blood glucose level, and lesser risk of becoming gestational diabetes. So those who are into the pregnancy phase only need to modulate a little bit on the way they are eating. Again, they need not follow any diet like a keto diet, which is actually for epilepsy. Need not do intermittent fasting, because you eat in a particular phase, you eat only few hours, and remaining hours you do fasting. You need not follow any fruit diet or any detox diet during this phase. It is very important to eat a healthy and balanced diet for you and for your growing fetus. That's extremely, extremely important. The vegetables which are iron rich, folic acid rich should be given more importance than trying to, and especially during this time, ensure that you're not aiming at weight loss. If you're
Thank you, Ruby. While we are at this, can I ask Dr. Sapna, is there any role for the family for these pregnant women? How do they support the girl during pregnancy?
I think family has a family and friends and support system. You can never undermine the importance that they have in, in any stage of life. And especially when, there are women who are already having a lot of self-esteem issues and, questioning themselves and anticipating the worst. So in pregnancy, for example, anyways, healthy women also are worrying about, especially if it's your first pregnancy, you're always hoping that everything goes well, but there are so many doubts and worries in your going on in your mind. And with PCOS, I think, educating the family is a huge, it has to be done with the families because there are mood swings, there is irritability, and there are so many other emotions going through a pregnant woman's mind, especially with those having PCOS. It's mandatory, I think, to educate the family about what that woman might be going through and how they can be supportive, because it can get difficult for the family as well. If a woman is going through mood swings, if the woman is constantly worrying about her child, and to an extent that it is pathological, it is about how do you sensitively and non-judgmentally work with these women to support them throughout those 9 months.
Thank you, Dr. Sapna. Twisha, do you have any exercises for these polycystic ovarian disease patients who are now pregnant?
I would say if they are looking at monitoring their sugar levels, in the acute phases, the aerobic exercises work well, because when somebody does an aerobic so basically sugars behave differently when you do an aerobic exercise and a resistance or a strength exercise. With aerobic exercises, the sugars typically fall while the person is doing exercise. As against that, with the resistance or strength training exercises like weight training, the sugars can either remain steady or they have a small tendency to rise. So with the pregnant lady, there has to be a very strict monitoring while all of this is happening. So I would say it's slightly safer to just continue with simple walking and aerobic activity. But nonetheless, very lightweight resistance exercises can still be done, because they are not going to shoot up the sugar too much. They will probably just maintain it, because in pregnancy, again, you don't want the sugar falling also, and so because of the strict control that has to be maintained. But for pregnancy, what I would say is best to do supervised exercise, because with resistance exercise, it's also tricky as to, because you need to avoid certain exercises. So if it's unsupervised, safest to go with walking, swimming type of exercises. And there's obviously a lot of yoga, prenatal yoga, etc., which goes on again, but it should be supervised is what I would say, because of the sugar fluctuation as well. And always useful to include pelvic exercises, pelvic floor, etc. exercises in pregnancy, but just gently to include it. And small chances in case these females are going to land up with certain other things in future, the pelvic exercises can become more useful.
Thank you, Twisha. What about Dr. Gulrez? These women that get pregnant and they have a little bit of acne. Do you all have any local applications or any treatment modalities available for them?
So for pregnant women, in fact, what happens in a PCOS woman who gets pregnant, sometimes the acne tends to flare up. And we do have local treatments. We do a lot of procedures. There are certain topical formulations of, say, azelaic acid, which can be given in a pregnant woman. If it is severe, then there are certain oral antibiotics also that we can, give to them in order to control the flare up. We do procedures like, there's something called as microdermabrasion. There are certain safe peels during pregnancy, like a lactic acid peel. So that kind of settles their acne and they can feel happy. Like Dr. Shashank was saying, that they need to be happy during pregnancy and that would keep them happy.
So all is not lost. Just because you're pregnant and you've got polycystic ovaries and you have acne, you can still look beautiful. Dr. Gulrez is there to give you all kinds of peels and treatment modalities. Dr. Sujata, what is mental resilience and why is it so important in polycystic ovaries?
So yes, so mental resilience is, your ability to bounce back, right? Whether it's a setback or a failure. Some people find it easier, some people find it harder, but it's a muscle that we can all build. It's not something that is a static ability. It's something that we can expand. And an important part of that for people suffering, young girls or women suffering from PCOS, one is hope, right? So resilient people are hopeful. They have an uplifting view of the future, right? They believe that things are going to get better. And the moment you're hopeful, you immediately feel like there's more energy, right? And that's something that one can inculcate. And gratitude. It's really, really important for mental resilience. Recognizing all the good things that you have going on in your life. Sometimes when we have a diagnosis of a disease, that becomes the focus of our mind. And that's the way the mind works. The mind, now neuroscience has shown us, will focus on something to worry on because it wants to protect the body, right? It's all about keeping the body safe. But that can go into overdrive, as we all know, and we get anxiety and depression. Both are like, two sides of the same coin as far as psychiatrists are concerned. And therefore, it becomes really important to protect ourselves from those mental health issues. And if we have them, then find ways of getting back into a healthier mind space. So gratitude is important. Hope is important. Mindfulness is incredibly important. So inculcating mindfulness, that's something that all of us can benefit from, whether we have PCOS or not. In fact, all of these are things that we can all benefit from, right? And mindfulness is essentially having an awareness in the present moment, recognizing the emotions that are coming up, and then regulating our behavior. So not reacting, but responding. This becomes important in the context of women who might have gotten into an eating disorder situation, right? Where you are eating, where you're binge eating in response to stress or in response to a trigger. And the moment you're mindful, right, that stress is the trigger, then you're more likely to choose a healthful response, whether it's calling a friend or going for a walk or just leaving the space where there is food. It could be different tactics that you could use. But mindfulness becomes really, really important in that space. And finally, I think what's important, and I'm talking to doctors here who are serving people every day, so you guys know this better than anyone, having a purpose that is bigger than yourself, right? With teenagers, it's a little harder. It's a little more, you're still very young, you're a child, but you're between childhood and adulthood. But finding a way to think about others and not yourself. The moment you do that, you're ahead of the game. You're building your resilience. So I think getting these young women to find some purpose in their lives that has nothing to do with themselves would really help them.
Thank you. Thank you so much. That's so much information for us to be able to translate in daily practice. Madam, now that we've spoken about the adolescent and the pregnant woman, do you think polycystic ovaries can still exist even in the perimenopausal or menopausal age group?
See, polycystic ovaries actually are most activated at puberty. That is when the girl first gets a period. And at menopause, the ovaries have stopped working. But by then, whatever harm it has created carries on with her post-menopause. In terms that during her lifespan, reproductive lifespan, if she's developed diabetes, if she's developed high blood pressure, if she's developed cholesterol problems, which are all associated with PCOS and being overweight, if she's got insulin resistance, all that has, accumulated into something what we call a metabolic syndrome. Now, with that metabolic syndrome, she enters menopause. And, till the age of 48, 50, till her ovaries are producing estrogen, it protects her. It protects her heart. But after her estrogen is lost from her body, her ovaries have stopped working. Then her chances of developing a cardiac problem because of all this metabolic syndrome is almost that becomes similar to men. See, if you compare men and women between 40 and 50, there'll be more men dying of a heart attack between 40 and 50 compared to women, because women are protected by estrogen. But after the age of 50, between 50 and 60, you'll find equal number of men and women will die of heart attack. So in short, it sort of builds into it. The PCOS has been the cause of getting into that situation, but now is not causing the problem. It's already created the morbidity or the difficult situation for that woman. And therefore, what we recommend is right from your younger days. Right from your younger days, follow a healthy lifestyle. Don't let fat accumulate. Don't let the cholesterol hit you. Don't let the sugar come in. Don't let this, just live a normal, healthy lifestyle and you should have no problems. So that is one issue, is the metabolic syndrome causing cardiac problems. And the second issue is about cancer. Now, polycystic ovaries itself doesn't cause cancer, but because of the irregular periods initially, where a woman will not probably get a period for 3 months and then bleed very heavily, we find that inside the uterus, the lining starts thickening. The lining of the uterus, which is normally supposed to be shed off every month, is not getting shed off, it's accumulating there. And then as she grows older, beyond menopause, that can convert into a cancer of the uterus. So that's the only cancer we fear in polycystic ovary patients. The other cancers are not really affected, but it occurs more in women. The women who are more at risk are the diabetic women, the women who are obese, the women who are hypertensive. Those are the women who are at a higher risk of getting cancer of the uterus. So that's what we need to look out for.
Thank you. Corpus cancer syndrome was a question you always loved asking all of us. And thank you so much for explaining it so beautifully to the audience today. Shashank, what can you do, Ray, to prevent this heart disease and all? We don't want to simply now we finish leading our lives, looking after our children, and when we are at an age where you have to enjoy, you don't want to deal with disease. What can one do?
3 things we can do, very easy. Never feel that after menopause you're losing the estrogen cover and you're weakening your heart and bones. Actually, if you stay fit and you listen to all these wonderful experts here, mindfully, eat slowly, eat on time, eat the right food, do a good 2-hour digital detox every day, sleep for a good 7 hours, and build all that, physical and mental well-being and health. I think we can prevent heart disease. But there are 3-4 things which I want to say. If we have risk factors like hypertension, diabetes, or we are blessed with family history, see, we can't change our genes, we can't change our parents. So, if we are blessed with some negative history, we need to be red flagging ourselves and taking care of ourselves. See, it's important. Sujata said that, we need to be selfless when it comes to sharing positivity, but we should be selfish when it comes to taking care of our own health. And that's very important. And that's equally important. So I think when it comes to our own health, we tend to ignore. And I call you all as, superwoman, because you all are doing 3 things. You have to manage crazy people like us at home. Then you have to manage kids and in-laws. Then you are professionally working in your careers. And obviously there is this triple stress. So, you need to have your own space. And that's what happens to a woman. And that's why if you see, 29th of September is the World Heart Day. And, women after menopause actually have a poorer prognosis and outcome when they get heart disease. And it's very crucial that we prevent them. Fortunately, in India, we don't have smoking as a big habit. It's picked up in some places. So, if you have hypertensive, diabetes, if you have heart disease history in the family, if you have premature deaths in the family after menopause, be cautious and careful and take care of all these control and factors. So risk factors control is the key. Then, you need to cut 2 things. If you have any tobacco related trajectory, we should chop off that tobacco. It's bad for the heart. And women do particularly badly if they are looking at tobacco. And rural India, women have still got that little tobacco addiction which needs to go. It's a big problem. The second thing is salt. We all love our papads and pickles and all that. And that really makes our blood pressure go up. And, we also like to be irritable and angry. And, it's a perfect recipe for a stroke or a heart attack. A little bit of papad, a little bit of a pickle, and a little bit of anger. It actually, once you're at 55, 60, it just triggers that heart attack, triggers that stroke, which you just don't want. And to make it worse, 4 or 5 hours of sleep. So 7 hours of sleep is equally important. Switch off everything. Achieve some nirvana. So that's my way to do it. We need to have healthy hearts in women after 50. And that's very, very crucial to stay happy and take care of all the cardiovascular risk factors. So whether it is blood pressure, whether it is heart disease. And the other thing is weight. You see, cosmetically, don't look at weight. Look at weight from a cardiometabolic standpoint. Even if you lose 5% of that weight, okay, that's good enough to reverse your cardiometabolic risk. So we just need to rewire ourselves, and it's more in the mind than in the body. And I think, it's very crucial what you asked me, because preventing heart disease is the key. Cancer we can screen every year. That we can do by doing tests, etc. But heart disease is 100% preventable, if you ask me. Just by adding 1 extra hour in a woman's life, okay, of sleep, and 1 hour of digital detox or me time, where nobody disturbs her, probably can actually make her live longer by a good decade or decade and a half. By the way, biologically, women are a superior sex, and they live 10 years more than men. This is global fact. And that's one of the reasons is because they had estrogens for some time. Unfortunately, PCOS women are not as blessed because their androgen took out their little estrogen sting they had. And which is why they need to have a holistic approach, and they have to behave as if they have a heart disease or a heart attack from day one. And if they have that mindset, they'll be careful. So I'm saying be mindful, be careful, but don't lose your ability to have those small little pleasures of life. So I'm not trying to be saying that don't do this, don't do that. You need a little bit of everything, but we need to know how to draw that Lakshman line.
Thank you, Shashank. So the key to all of this is moderation, and I think all of us have learned that, whether the right way, the wrong way, but we all learned it at some point, and we're doing well. Dr. Gulrez, do you think that there is any role in the perimenopausal age group for patients who complain of thinning of hair? It's like such a common problem. They come and say, "Doctor, I'm putting on weight, I'm losing my hair. Will I get bald?" Is there something we can do for them?
The thinning of hair, what you just described, is something called as female pattern hair loss. And I'm going beyond the scope of the question to share with you that nowadays we see this happening even in the young girls, at the age of 18, 19, at such an early age, female pattern hair loss is being seen. The initial presentation used to be, where the frontal part of the scalp used to be affected. But now we even see the bitemporal. This area is called as the bitemporal area, and we see that happening even in young girls. Now, this female pattern hair loss, the association with the androgens is not confirmed, but increasingly we are seeing it in PCOS patients, though the percentage compared to the other manifestations in dermatology like hirsutism and acne is pretty low, but it's being increasingly seen. And the good news is that yes, we can do a lot for such patients. There are oral medications, there are topical lotions that they need to apply, and a lot of office procedures. Kind of a lunchtime procedure that we can do for them, which can absolutely help their hair to grow. Of course, the areas which have completely become bald, bereft of any hair follicle, the only solution is hair transplant. But in women, hair transplant is not a very common phenomenon. They come to us, I think, before they reach that endpoint. There are most people who come to us to seek help.
They're very conscious about their hair, and most women, kind of correlate hair and beauty. They're extremely conscious about it. And yes, thank you.
Yeah, and one more point which I would like to add is, with relation to treatment for hair loss and this female pattern hair loss, also called as androgenetic alopecia. The important message that I would like to share with the ones who are viewing this is that the treatment is extremely long. The 9-month incubation even applies to this. So when we start the treatment, the full effect is seen only after 9 months, because the hair cycle is of that duration. Our skin cycle would be, say, a 28-day cycle like our menstrual cycles, but the hair cycle is 9 months. So to see the full effect, the person has to use these lotions, the tablets. Minimum period is 9 months. And it can extend beyond that if they really want to maintain their hair growth. So patience is the key.
A lot of patients, a lot of options available. It's just to choose the right one at the right time. Having said that, Shashank just mentioned that sleep is extremely important with patients with polycystic ovaries. Sapna, can you please tell me what is sleep hygiene and what has sleep got to do with polycystic ovaries?
We see certain, sleep disorders, especially in people with PCOS, inability to fall asleep. And, because of that, there is lack of feeling rejuvenated in the morning. So they don't feel like they've rested enough because they have disrupted sleep in the night, leading to daytime drowsiness. And they also suffer from something called sleep apnea. That is they stop breathing for a few seconds in the night. So these are the common kind of conditions that are associated with PCOS. Now, sleep hygiene is a non-medical way of dealing with sleep disorders, and that includes, various steps, including being gadget-free at least for 2 hours before, screen-free time before going to bed, not having caffeinated drinks at least from 6 o'clock in the evening. After that, not having any caffeinated drinks, avoiding doing any strenuous kind of exercises towards the evening time, having a nice calming bath, listening to calming music, avoiding daytime naps. And so that are few steps that we tell patients to follow, especially those who are having, difficulty reading books, for example, rather than watching a Netflix show, which most of us do. So things like that are extremely important because the blue light, for example, causes us to be awake further, and it's a vicious cycle then. So simple things like this, if you're not feeling asleep, rather than tossing and turning in bed, we advise that they just get up and move to another room, sit for a little while, read a book, and then come back, because otherwise the unhealthy associations are formed. So all those steps come together to form sleep hygiene, which we use in clients who are having difficulty falling asleep or remaining asleep at night.
Thank you, Sapna. Thank you very much. Ruby, I have a question that has appeared here. And somebody says that before periods, I feel very hungry. I eat at night and I eat a lot. Will that cause a problem for me? Should I drink a glass of milk? Will that be better?
So the choice of foods can help the patient. So if you are eating foods which are high in sugar or carb, will actually lead to such cravings. If the meal is tweaked, if the composition is changed from carbohydrates to protein, and if you include a plate of fiber, like a salad will help you. So something like this, if you make the patient understand that, before the meal, if you ensure that your plate is full of vegetables, at least half of it, then your next meal hunger will reduce. You will not binge on and wake up in the middle of the night. So pre-dinner, pre-lunch, or at the evening snack time, you can think of something like this, so that you don't end up, because eating more is going to add up to your weight and make you more insulin resistant. So there are ways to curb your hunger by choosing the right foods.
Thank you, Ruby. Thank you so much. Twisha, there's somebody that's really thrown a question here, which I'm very intrigued with. I do a lot of weight training. Will I become more manly?
There are these people who have lots of protein shakes to build up those muscles. Yeah, you should ask them, because that's a big fear which a lot of women have, especially in this, the 40 is, if we are talking about the perimenopausal women already just now, they feel that we encourage them to do weight training, because that's when this is the age when the sarcopenia is setting in, the muscle wasting is setting in, and weight training would really help to maintain that muscle, but it will not really make it bulk up. Bulking up requires a lot of effort, and that's why these bodybuilders and all these young boys are having so many protein shakes, etc., which are probably God knows what else do they have. So it will not make somebody manly if it is done in the right the sets, reps, what we call for weight training. That's the number of times you're doing the lift, how much weight you're lifting. So of course, all that has to be properly managed by somebody. It has to be guided by somebody. But for achieving health, the sets and reps which are required, that does not make somebody bulk up to that extent. But achieving those minimum sets reps is definitely required and highly encouraged and recommended, because it helps avoid this sarcopenia, and sarcopenia has been linked slightly to heart disease as well. So preventing developing sarcopenia helps prevent heart disease also to some extent, because we were already talking about that. And that's where a lot of females, I think, tend to take up yoga, because they feel that, okay, yoga is going to not help me bulk up, which is great. But just to tell them that, yeah, within the yoga, please don't focus only on the flexibility bit, focus on all the arms of the yoga element, and that will include a little bit of strength work also to help them.
Thank you, Twisha. That really explains a lot of it. Shashank, I have a question here for you. And the lady says, I'm never able to lose weight. And somebody suggested that I should undergo bariatric surgery. Will it affect my married life?
So, if you are morbidly obese with a BMI of above 40, your married life will actually improve once you lose weight. So that is the only indication for bariatric surgery. Before you do bariatric surgery, you should tell and get a psychiatric evaluation for every patient. Dr. Sapna will agree with me there. And the second thing which we should do is that there are two side effects of bariatric surgery. Number one is that it is not lifelong, and it has a soft association with suicide. It's a little scary to say. And it has a soft association with fractures. So these are the two risks you take medico-legally when you undergo bariatric surgery. The biggest challenge with bariatric surgery is which procedure to choose. The surgeons have their own whims and fancies. So bariatric surgery is undergoing a learning curve over the last 3 decades. The original surgery was biliary pancreatic diversion, very barbaric surgery. Americans love to do gastric bypass. In India, we must have heard sleeve. Ladies wear sleeveless and they get their sleeves cut out. That is what there's a dictum in the social pastry circle, and Duru madam knows it very well, that they love their sleeveless and they love their sleeve gastrectomy and they love their surgeon. Okay, and that's what they do. But actually, their sleeve gastrectomy recurs after 2 to 5 years. And now after 15-20 years of experience handling bariatric patients, some of them came hypoglycemia. But if you are morbidly obese, or if you are just not able to handle yourself, and if you are mentally capable and competent to handle it, we have treated people who are infertile and actually have been able to conceive after bariatric surgery. So for morbid obesity, I think it's a clear-cut yes. When it comes to BMIs of borderline in 28 and 35 and 32 to fit into the right clothes and the right size hero for a wedding function, I don't think bariatric surgery is recommended. So it is not a cosmetic surgery. It's a metabolic surgery. It has very good metabolic outcomes, including remission of diabetes and hypertension, but also has the con side to it. And therefore, except for morbid obesity, we don't routinely recommend it. And for PCOS, I think it is a little outrageous there. So I would not recommend it unless and until somebody is really morbidly obese.
Thank you, Shashank. That kind of summarizes the entire thing for us. There is no slipshod, quick mechanism to lose weight. It's dedication, hard work, diet, and who but me knows that so much more. But having said that, I would like for all of you, we've been on at this for more than an hour, one quick take-home message for every woman that's listening to us today. Any one quick couple of lines to the audience, for them to take home that all is not lost if you have polycystic ovaries. There are treatment modalities available. Regularizing your lifestyle with, wellness, psychiatrist, psychologist, everybody. I would like one of you all to just start and set the ball rolling.
Maybe I'll start because I'm the odd man out in this woman's world of gynec world of MAP. Okay, so I think first thing is I tell every PCOS person or woman to love herself I think there is an image issue when they come to us. So I think it's important to love yourself. Second is be happy. And third is that there is nothing which is impossible. I think those are the three simple take-home points. Eat a little less, eat a little slowly, eat on time, do sleep well, do a little digital detox, do some exercise. If you are wonderful experts like Twisha, Sapna, Gulrej, Ruby, we are not needed. Duru, me or Anita, you are not needed. They can take care of all our patients. We are really just the outliers. They are the core. So I think be happy, love your own self, take care of your health, and nothing is impossible.
I think I'll go next. I can only say that, we have seen wonderful outcomes in PCOS patients who have done their bit, dedicated their time towards improving their lifestyle. We have seen excellent outcomes in such women. They have been able to maintain themselves as well. Patience and keeping the spirit going is the way to go for a PCOS patient.
I'll go next. Just get active. Don't worry about what time of the day should I do the activity, how much activity. For starters, just get active. If you are not seeing results, then take help, take consultation and take it from there, because exercise is a medicine and it works best when it's done in the right doses. But for starters, just let's encourage our patients and all of y'all listening here. If you haven't been doing any activity, just get moving to start with.
So I'll go next. I think
sitting for some time, yeah. So some little activity is called for.
Absolutely. So I was just saying, one of my take-home messages would be it's okay to be selfish. Look after yourself. Give yourself some time. Find your support system. It could be friends, it could be colleagues, it could be, professionals, it could be family, but find the support system because that is what will keep you going. Our motto, for example, is okay not to be okay, but it's not okay not to seek help. So, help is available. Please just seek us out, or anyone that you can, who needs it, because there is always help available. All we need to do is ask. So do not suffer in silence.
Yeah, I'll go next. Just to clarify, when I talked about selflessness, I wasn't intending to mean at all that we shouldn't look after ourselves, because if we don't look after ourselves, we can't possibly look after anybody else. So even complete our goals, whether they're professional or personal. So looking after ourselves from a health perspective is absolutely crucial. And I invite, whoever's listening to have a mindset where you recognize that, you're growing, you're changing moment to moment. So you can learn these things. Nothing that any of these experts and dedicated physicians have told you is impossible. It's all very doable. Habits take time to form, but they can be formed. And you can change your life for the better. So keep that hope alive. Be grateful for all that you have, and you will see the change that you seek.
Twisha, your turn.
I already spoke, but I can speak again.
Okay. Sorry, then I missed.
Ruby.
Myself and Duru ma'am.
Okay.
So I would like to say, all that you've heard today, start with one advice from everybody. Small steps will actually lead to the result that you want. And remember that you are not bigger, PCOS is not bigger than you. You are bigger than PCOS. So reach out to the right people and at the right time and seek the right help. Do it before the PCOS takes over you. It's never too late. You can start any time of your life. You will live life like a non-PCOS, like a normal girl, if you start your treatment as early as possible. Don't delay.
Ma'am, concluding remarks from you.
I would say you're 1 out of the 5 people around you who has PCOS. It's no big deal. It's easy to deal with it. Just get on with it as quick as you can, and you'll be outsmarting it very, very soon. So get there and start.
Thank you, ma'am. all of you have been phenomenal. And I just can't thank each one of you enough for taking time out, doing this panel. And I think, or I hope, we've been able to cover every question that, would possibly come into people's minds. For those that have any more questions, feel free to go onto the PCOS Society website. Post your questions there. We will definitely answer. And thank you, Madam Durusha, for giving me the opportunity of conducting this panel. Thank you.
Thank you. Thank you for doing it so well, Anita. Thank you.
Thank you so much, Dr. Anita Soni. That was a wonderful panel discussion. And I really thank all the panelists for having given their inputs. This is really from those who see the patients in and out. All these questions asked are generally asked by every patient walking into a doctor's clinic, a therapist clinic, a nutritionist clinic. I thank all of you for such a wonderful panel discussion. From here, we move on to the next part of today's session, where we will actually see what are the best ways of cooking for recipes or the tips that were shared by myself during the panel discussion. For this, we are very, very honored that we have a celebrity chef with us, Chef Harpal Singh Sokhi, who has taken his time out to show us a very healthy recipe, which is actually very useful for those who are working, those who go to college, and they want to have a quick one-pot meal, which is very healthy, nutritious, and at the same time, ideal for both obese and lean PCOS. So here we would like to show you the recipe directly from the chef.
हेलो जी, नमस्कार। मेरा नाम है शेफ हरपाल। कैसे हैं आप लोग सब? भाई, तंदुरुस्त रहने का मतलब ये है कि आप खाना हेल्दी खा रहे हैं, और ये जो समय से हम गुजर रहे हैं, और इसमें तो और भी आवश्यक है कि आप घर पे बढ़िया खाना बनाएं, पौष्टिक खाना बनाएं। तो हम बना क्या रहे हैं? हम बना रहे हैं मल्टीग्रेन खिचड़ी।
Thank you, Chef. Thank you so much for showing such an interesting, easy, very delicious recipe to all of us. I'm sure everybody watching this program will try this and will be using this recipe, and it can be made more nutritious and more tastier by experimenting with your ingredients in your own kitchen. Thank you so much, Chef. That was really, really great. I'm really grateful to you for showing that recipe to us. Moving on, we also have another session where we are going to show you some exercises which you can show. As our previous speaker in the panel discussion, Dr. Trisha Parekh, mentioned some of the exercises which are suitable for both overweight and lean PCOS. We are going to show you some exercises which you can be actually very tailor-made and very specific to you once you connect with your specialist. As we have discussed that each patient is different. However, we just want to show you some entire range of exercises, like what is aerobic exercises, what are resistance training, what is strength training, what is Pilates, some forms of yoga. So here we show you some exercises by two experts. My dear friend Shweta Bhatia, who is a registered dietitian, and a Pilates trainer, Miss Jyoti Patil. Let's see what exercises they are here for us to see. Over to you, Jyoti, and over to you, Shweta.
Hi everyone, this is Shweta Bhatia and I'd like to show you a few exercises including resistance training, cardio and stretches for women with PCOS. These are not only for fat loss but also to improve insulin sensitivity and maintain muscle.
exercises were really very simple. And I'm sure it's not so difficult for us to go back and find some of videos on the YouTube to learn in depth, or connect with our trainer to learn and do under supervision. These are very, very important forms of exercises which are suitable for all those who want to prevent PCOS as well as those who already have PCOS. I think all of us can really do some of these exercises, whether we are at home, whether we are working, whether we are traveling, or during our working and college hours as well. I think we must incorporate some of these exercises in our daily life, as suggested by our expert earlier. Thank you, both of you. Thank you, Shweta, and thank you, Jyoti, for these lovely exercises that you've showed us today. Thank you so much. We also have some more videos actually. These videos are going to be played towards the end today, which will also in gist tell you about all the discussions we had today. Let's not waste any further time. Let's hear it directly from somebody who has overcome the PCOS by lifestyle. And she's none other than Mrs. Riddhi Talreja. She's a filmmaker and she's a very well-known celebrity. And it'll be amazing to hear from her that how her lifestyle changes could help her conquer PCOS. Over to you, Mrs. Riddhi Talreja. We are very keen to listen to your own experiences.
So hi, I'm Riddhi Talreja, and I've had PCOS since I was 13. At the time I was first diagnosed with PCOS, I didn't know what it was. My mother didn't know what it was. Nobody around me knew what it was except for my doctors. And it sounded really frightening to have cysts on your ovaries and what the possible side effects of that could be. There wasn't a lot of information out there, and so I didn't even know where to start or what to do. And I was really angry that my body was betraying me with no real fault of my own. My periods were extremely irregular. And finally, when I didn't get it for 4 months, I was put on birth control, which has its own side effects. I got headaches, I was irritable. I was also in college, so I had a lot on my plate. And if I missed the pill, there were more issues like spotting or getting my period too early. And that's the first time I realized that the potential side effects of PCOS weren't only physical, but it also had a mental toll. A couple of years later, I decided to go off birth control, which led me to put on a lot of weight. My hormones were a mess. I would get really bad PMS symptoms, mood swings, bloating, bouts of depression and anxiety, and my period went back to being super regular. I almost didn't feel woman enough. I wasn't getting my period. I was growing hair in places I didn't know was possible. My testosterone was high. My cholesterol was high. My blood sugar was high. And I was just in my 20s. I started to get comments about my weight. I was made fun of. I was really miserable and I was scared. I didn't see an end in sight. It was like a vicious cycle. So the more weight you put on, the worse your symptoms of PCOS get. And the worse they get, the harder it is to lose weight. And I was stuck in that cycle. Dr. Duru advised me to better my lifestyle, and I took it up as a mission, but unfortunately in a completely wrong way. There's already so much pressure by society to look a certain way, and then with my deteriorating health, I ended up crash dieting, over-exercising. I lost 14 kgs in 3 months, and I went too far with it. My immunity dropped. I got sick for 3 or 4 months. I had to have steroids, and my symptoms of PCOS persisted through all of that. I started again to feel helpless, but at this point, fortunately, the internet started to become widely available for information. I started researching PCOS and I realized that I wasn't alone in this. So 20% of women have PCOS in India, which is 200 million women in India alone. Globally, the number is obviously much larger, and yet it's not talked about as much as it should be. Most of all, I started realizing that I managed this condition for the rest of my life, that there wasn't a cure for it. But the good news was that I wasn't alone. There was a large community of other women that were going through the same thing, and that could help me through this journey. I refused to take any pills that directly affected my hormones. Now, I don't really recommend this. I remember Dr. Shah and her team kept prescribing me medicine that would have been good for me, but I kept refusing to take it because I am stubborn and I've had bad memories associated with it. I wanted to do it naturally. So it took me some time, but I finally found a place of balance. I started eating the right amount of macronutrients, which is like proteins, fats, fiber, and carbs for my body. I started weightlifting. I made healthy living a lifestyle. And I know everyone's probably heard this before, and it might not be the only solution. And it isn't as easy as it sounds, but working out doesn't mean spending 2 hours in the gym and spending a fortune on trainers and dietitians. With technology now, I follow free workouts on YouTube for 40 minutes a day. And I downloaded an app on my phone that tracks my nutrition so I could adjust what I ate according to what I wanted. And I wasn't restricting myself too much. Like if I want a piece of cake, I have it and I adjust the rest of my fats and sugars for the rest of the day. So I became in charge of my own health, and that made a big difference. Over the years of doing this, my hormones started stabilizing. I remember I was at Dr. Shah's office and we looked through my reports from when I started going to her till the present day, and we could actually see the improvement in my hormone and blood sugar parameters. And she didn't prescribe me any more pills. That gave me so much hope and happiness. Not to say I still don't have some symptoms. I still have stubborn facial and body hair. I get cystic acne, and the cysts on my ovaries are still very much present. I do take supplements like primrose oil and a combination of vitamin B6, magnesium, zinc that further help make my symptoms manageable, and that's where I am. I get my period 28 days on the dot now. My PMS symptoms have become infinitely better. I feel less anxious when I exercise. It made me realize that in a way that PCOS was a blessing. I wouldn't be focusing on my physical health as much as I do. And it gave me no choice but to work on myself physically and mentally. I feel very in tune with my body because of it. So in that way, it's been a good thing for me. I love that this event is happening because not only does it raise awareness of the toll of PCOS, but it also lets us know that there's a community of women supporting and encouraging each other through the pain of all of this. We can help fuel more research on women's health and find more ways to manage this condition, which is so common. There are so many of us. I hope this gave you some insight into the condition and how I've been able to manage it, and the realization that you are not alone. Thank you.
Thank you, Ms. Riddhi Talreja. You're so inspiring. And I think this is so encouraging for all the people listening to this, that yes, PCO may not be curable, but yes, it is possible to overcome PCOS with these beautiful changes that you have been made in your life, in spite of being so successful in your career. And I think there are many more stories coming up hence hereafter once they listen to you and follow these tips in their own life as well. Thank you so much, Riddhi, and wish you a great life ahead. Thank you so much for being with us and sparing your valuable time. Thank you. We now move forward to the most awaited session of today's webinar. And I'm sure the students are waiting for this for the last 2 weeks. Well, now we come to the award session. We had conducted a contest all over India for students to participate in the digital video and slogan categories of PCOS awareness. And it was amazing to see such an overwhelming response. More than 100 videos came in as their responses. I mean, seeing their efforts was really overwhelming. We had the judges who have seen these videos, and today we would like to announce the winners in today's session. We have received entries from all over India, from tier 2, tier 3 cities, from everywhere possible. Students, you've done a great job. Some of the videos that we've received were really, really very interesting, very amazing. I must say all of them are winners, but we still have to select 2 out of these. So let's see who takes the second place today. So the second place for the video contest winner goes to then let's see the video. Congratulations. Now, let's see who takes the first prize in this video contest for the PCOS Awareness Program. And the name is Then let's see the video which has won the first place. Wow, congratulations. That was a very nice, lucid video, which is very, very useful for all the viewers. Great job. Once again, congratulations to you, dear. Soon, we will be sending a check to you. Moving forward, we have received a big number of entries for the slogan category as well. Now, let's see which slogan, some of them which we received were something like this, something more interesting, and some more explanatory. Among all of these, we could select slogan which won the second prize in this category is Congratulations to you. Now we have the first winner in this category of slogan contest, and the first prize winner is Heartiest congratulations to you. Both of you will shortly receive your checks. And I must thank Ms. Riddhi Talreja for being one of the judges for this contest. My heartiest congratulations to all those who have participated and all the colleges all across and all the departments who have involved in this contest. Thank you so much.
We have had a wonderful day today. It's been wonderful to listen to everyone and share all what we had to speak to you. We have tried to concise it in as little time as possible. We would have loved to do a 2 or 3 day seminar with all of you. We would like to take this opportunity to thank all those who have made this program possible. First of all, our chief guest, Mrs. Hindushani, who has graced this occasion and spoken so beautifully to all of us. Mrs. Namita Thapar, who has been our guest of honor and who has also, come in and given us a beautiful talk, which I'm sure all of you have enjoyed. I would also like to thank Mrs. Riddhi Talreja, who's a filmmaker, for being so kind enough to speak about her personal experience on how she overruled or overcame PCOS. These are the three people whom I really appreciate for coming in and talking to all of us. Without our experts, this program would have just not been possible. Our experts are the ones who are treating women on a regular basis, on connecting with them and taking them to their goal of various things, depending on what they have seen us for. So first of all, I'd like to thank Dr. Shashank Joshi, who's an endocrinologist, very well known, seen on TV very often, and he's the one who manages the endocrine problems of PCOS. Of course, then we have Dr. Gulrez, the dermatologist, who takes care of all the skin issues, and these are areas which young girls really are embarrassed about, but today, luckily, we have so much better therapies available to help everyone. Dr. Tisha Parekh, who's a sports medicine expert, and she's a well-known physiotherapist and really deals with sports injuries, but physiotherapies and real fitness expert. So this is something which I'm sure all of you have benefited from. Dr. Sapna Bangar, who's a psychiatrist, and she focuses on mental health, and she's the one who makes sure that she understands the patients, understands their moods, and tries to guide them how to go further. Takes them out of all their bad moods, helps them to have good moods, sleep better, etc. Dr. Sujata Shetty, a dear friend, and she is the one who's a wellness person who goes around taking wellness classes for people, courses, and she trains hundreds of people. She's written a beautiful book, 99 Not Out, meant for doctors to read. I think all the doctors in the audience should think about reading that book. I must also thank our moderator, Dr. Anita Soni, who did such a brilliant job with the entire panel discussion. I'm sure all of you were kept absolutely awake and did not even think for a minute or did not even doze off, I'm sure, for a minute. I must thank Dr. Ruby Sound, who's a nutritionist, and she has been so extremely helpful in coordinating this and putting everything together. Without her, it would have been just impossible for for us to have this program today. So a big thank you to all our experts who have come here, who have made us all very aware of what's going on with PCOS and how to manage it, and have been they've given us so much of their time and expertise. I thank all of them very much. The other people I would like to really thank is the Omnicurus team. The platform which we are using just now, they've worked very, very hard. They've extremely been very cooperative. They've been so good about the whole thing. We have troubled them a lot. Sorry, I can't make it now. Things like that. We as doctors keep having timings which are not the best, and they've been very, very tolerant. And they have, we've tried to create a beautiful atmosphere, a little different atmosphere. And I hope you all enjoyed it. It's thanks to the Omnicurus team who has created this specially for all of you. I must also thank our social media team of Brand You with Ritu, who has her team with her, and Ritu and Swarda together work towards creating all the wonderful brochures and pamphlets, etc., which they have created. A special thanks also to the thousands and thousands of students out there who have participated and who have come here today, and to the people who have all the women who are there because they want to learn and who have encouraged us to talk to them and help and sort of try and clarify all the issues which we have been having. So thank you very much, because without an audience, it makes no sense for us to keep talking. We've also had lovely clips which have been sent to us for the best, for a very healthy diet and for the exercise. I also appreciate the effort which two of our other guests who have, come in and helped out by giving a lovely video on a healthy recipe and a lovely exercise video on how to stay fit, both for those who are lean and those who are overweight. So thank you very much for sharing those videos with us. I'm sure they're extremely helpful to everyone who has been here. I also want to congratulate the winners of the competitions we have had, the video competition and the slogan competition. You'll have all seen it. They're brilliant, absolutely. And I must congratulate. We've had so many entries, 100 entries plus. And I'm so glad that we have got these winners in both the areas. And I congratulate them for all their efforts. And we have shown them to you. So showing that we really appreciate what they have done. So in short, I think I have thanked everyone. I do hope I've not missed out anyone. The team at Omnicurus, of course, I have forgotten to give their names. One is Mr. Farhaz and the other is Mr. Shobit. Both of them have done a brilliant job. And of course, Mrs. Soumya, who also heads one of the team, I would like to say a big thank you to her also for having introduced me to this concept. So thank you once again for everything. And I now request Dr. Ruby Sound to close the session so that we can all go ahead and enjoy the evening. Thank you so much.
Thank you, Duru ma'am. I think you've made my work very easy. You've already proposed a vote of thanks, but I really want to say a few last words. And if you have missed on anybody, I would like to acknowledge them before we close the program today. Of course, firstly, the delegates, without whom this program would have been possible. It is for you. So make sure that this program is circulated with your other friends and colleagues whom today's program can be very, very useful. And to all the chief guests, to all the experts today, all this was planned and conceived by Dr. Durusha ma'am. So a very, very big thanks to her from the bottom of my heart. A big thanks to our celebrities who spared her their time. Ms. Riddhi Talreja for sharing her experience. Chef Harpal Singh Soki for sharing the video. Shweta Bhatia and her team and Jyoti Patil for sharing the exercises with us. And this wouldn't have been possible without the support of MCure Pharmaceuticals. My big thank you to the technical Omnicurus team, Ms. Ritu and Ms. Varda from the marketing and creative team who works with the PCOS Society. And last but not the least, the entire PCOS Society. Well, I think this program was possible only because of the collective efforts of all of these. Well, for all of those who want to become a part of this team, those who want to become a part of this entire PCOS awareness program and the PCOS Society, all of you can log in at www.pcosindia.org. And there is a patient information section where you can see more videos, where you can find out more information. There is a platform to connect with each other, reach out to the experts and learn more about PCOS. And I think this PCOS Awareness Month is incomplete without conducting such a PCOS awareness program. So last but not the least, a big thank you to all of you. Have a great evening further and hope to see you all soon. Stay fit, stay safe and be PCOS free. Thank you so much.